Hello, my name is Joanna Saishon, and I am recording this for week 2 of pathophysiology. I have this sheet of notes here. The back is blank. Whoop. Um, and getting right into it, disease. Disease is a dysfunction in the body. It is associated with certain signs and symptoms specific to each disease. And the examples that I'm going to be using are going to all um, be around celiac disease. They're all going to involve celiac disease. So it is an autoimmune disorder that affects the immune system. It's a dysfunction in the immune system and a dysfunction in the small intestine with specific signs and symptoms that I can talk about later in the video. Next, we have disease classification, and these are the various types of disease, how diseases can be categorized. So, physical diseases, mental, congenital, and acquired diseases are all different types of categories, among others. And celiac disease can be a congenital disorder, it can be acquired at birth. Next up, there's etiology, and etiology is what causes the disease, what triggers a disease state. So, consumption of gluten peptides, of gluten contaminated food, that will cause a disease state. For celiacs, it will cause the autoimmune response. After that, there's pathogenesis, and it's the cellular or at a cellular and tissue level, what happens from the beginning of a disease to the end, how those specific components affect the person. So there's the atrophy of the villi in the small intestine for celiacs. That atrophy will lead to malabsorption of nutrients, and that malabsorption will lead to malnutrition. After that, we have the symptoms. These symptoms, as mentioned before, they're an important part of determining a disease. It's how the person is feeling, how the patient feels, what's going on in their body. Um, and these for celiacs can be things like irritability, a lack of energy, and many gastrointestinal symptoms, discomfort, pain, things like that. Signs, on the other hand, are similar to symptoms, but they can be seen by a physician. They can be observed, measured, tested. Something like weight loss over a period of time can decrease, or weight loss is a decrease in weight, but over time, a physician can measure that. The unexplained iron deficiency anemia can also be another sign that a physician can see and measure. After that, we have the combination of the two things, signs and symptoms, and that's a syndrome. The syndrome is essentially a list of certain things that can be compared to other diseases, um, and see which one aligns the best with this, which signs and symptoms align best with this specific disease. So for celiacs, it's a mixture of the gastrointestinal pain with the weight loss, with the unexplained iron deficiency anemia, and maybe some diarrhea, things like that after eating gluten. That's the syndrome. Um, and after the syndrome, we have the diagnosis. The diagnosis is just the label that we put on the disorder, the dysfunctional state in the body. So that's the label, celiac disease, that I've been referring to this whole time. After that, we have some complications. Complications are unforeseen events that happen throughout the disease, throughout the time of the disease, or from the treatment of the disease. This can be malnutrition in the long run for celiacs if they keep eating contaminated foods. Um, Malnutrition will result because of that atrophy in the small intestinal villi. There can also be, unfortunately, miscarriages that can happen. Um, And after complications, we have the prognosis. And the prognosis is how the disease will most likely pan out, and how one can recover from it or how they may not recover from it. What's the future for the person with this disease? So for celiacs, staying away from gluten-containing foods, or things that may be contaminated, they can restore some of that intestinal villi, restore some of their immune responses, and decrease all of that inflammation going on in the body. And after that, we have the diagnostic testing. Diagnostic testing can be something um, that really aids in diagnosing a disease. The lab imaging, lab work, blood work, and for the imaging we have like the CT scans, the MRIs, things like that, things that you can see where the dysfunction lies. You can compare a healthy MRI to a sickly MRI and see where there are some differences. Um, so for people with celiacs, you can get a biopsy of the small intestine and see if those villi are atrophied or if they're healthy, how they're doing. Also blood work. There's the blood work searching for antibodies that helps diagnose people with celiacs. And yeah, that's about it.